Another pandemic in the United States that relates us to lack of sunlight, lack of vitamin D, is the pandemic of hypertension. It's very interesting. That particular disease continues to become more prevalent in the United States of America, and everyone's taking some type of drug to prevent hypertension, or so it seems. Not everyone, but a lot of the people are. And what's interesting to note is that if you take a look at just vitamin D levels in the body, that those people who have the lowest vitamin D levels have 6 times the risk of getting a hypertension, of having very, very high blood pressure, in other words. Not for women, though, that's for men. For women, it's only about a tripling of the risk of becoming hypertensive. So sunlight makes a difference because sunlight is what produces your vitamin D. About 80 to 90% of all vitamin D production that we have is due to sunlight on the skin. The rest is due to dietary and supplementation and so forth like that. But if we do not want to be hypertensive, we need to get out in the sunlight. Another thing that sunlight does is to stimulate nitric oxide production in the skin. Nitric oxide causes vasodilation in the arteries. If we have a nice vasodilated artery, artery that's clean and clear and has good flexibility, which nitric oxide can bring to it, then we have a much less chance also of becoming hypertensive and can actually get a therapeutic effect almost immediately by walking out in the sun. Think about that and direct your feet to the sunny side of the street.